trying to build a universal healthcare system in a country where some of your patients live at like 15,000 feet up in the Himalayas.
Right, entirely cut off from modern roads.
Exactly. I mean, you can't just build a massive state-of-the-art hospital in the capital and, hope people somehow walk in.
Yeah, that's just not going to work.
Right. So when a mother goes into labor in a remote village or a child develops severe malnutrition miles from the nearest paved street, the system actually has to go to them.
It has to be completely proactive.
Yeah. And so welcome to this custom deep dive. Today, we are looking at how a nation actually engineers that kind of sprawling cradle-to-grave safety net for you. We're going through a fascinating document. It's the Nepal Nursing and Social Security Services Program Report 2080/81.
Which I know sounds like a very dry, dense piece of bureaucracy.
It really does. But it is actually this real-time blueprint of a country fighting societal vulnerabilities across just extreme geographic and economic landscapes.
It's incredible because the overarching theme in this document is that public health, at this kind of scale, it operates far beyond the walls of a clinic.
Yeah.
It is fundamentally about highly targeted grassroots interventions. You have to intercept the problem before the patient ever needs a doctor.
Right. I actually found myself thinking of the entire Nepali health infrastructure like a national immune system.
Oh, I like that.
Yeah, if you look at it that way, you have these different cells, nurses, community volunteers, specialized emergency funds, and they're deployed to attack very specific societal ailments.
And they aren't just treating biological infections, right?
Exactly. They're treating malnutrition, domestic violence,
Yeah.
and even catastrophic financial ruin.
Well, and to understand how an immune system functions, you really have to look at the cellular level first.
Right, the baseline.
Exactly. In the context of a nation's public health, that cellular level is the individual household. I mean, you can't enact change until you know what is happening inside the home.
And that is where the frontline army of this system comes into play. The female community health volunteers, or FCHVs. I mean, I was blown away by the scale of this.
It's massive.
The program was established in 1988, and today there are over 50,396 to be exact, of these volunteers actively serving across Nepal.
Which makes them the absolute backbone of maternal and infant care in the country.
Yeah, what are they actually doing day to day?
Well, their impact on infant mortality alone is staggering. When a child is born at home in a rural area, it's the FCHV who is physically there, ensuring the basics of survival.
Right.
The report notes they facilitate skin-to-skin contact, which, that regulates the newborn's temperature and heart rate. They apply chlorhexidine to the umbilical cord.
Wait, what is that?
Oh, it's a very simple, cheap antiseptic, but it prevents severe infections that used to be a leading cause of newborn deaths.
Wow. Just a simple antiseptic.
Exactly. They also distribute postpartum vitamin A to the mothers. I mean, these aren't complex surgical procedures.
Right, they're just basic protocols.
Yeah, fundamental life-saving protocols executed right at the village level.
And they're also conducting massive screening efforts, right? Like, these volunteers walk around their communities with MUAC tapes.
MUAC, yeah, mid-upper arm circumference.
Right. It's essentially this simple color-coded tape measure that you wrap around a toddler's arm. And it's brilliant because it requires zero electricity, no medical degree, and yet it immediately flags if a child is malnourished.
Yeah, if it shows red, the child is in immediate danger.
And the data they are pulling in from this is intense. Like in the Madhyash province alone, they found that 34.4% of the children they screened had severe acute malnutrition.
Wow, over a third.
Yeah, it's wild. And the sheer volume of work they do makes their compensation model fascinating.
Right, because they operate entirely on a volunteer basis.
And mostly, yeah. The government provides them with a 10,000 rupee dress allowance and a 12,000 rupee travel allowance per year.
Which is an incredibly modest sum for an army of women who are fundamentally altering the health outcomes of millions of people.
Okay, let's unpack this, because I was reading through the SWOT analysis in the report. The strengths, weaknesses, opportunities, and threats for the FCHV program, and I found a deeply human quirk in there.
Oh, the nepotism issue.
Yes, it cited nepotism as a threat. Apparently, these volunteers are very reluctant to retire, and when they do age out, they simply pass their jobs down to their daughters or daughters-in-law.
Yeah, which reveals a lot about the sociological dynamics of the role,
How so?
Well, it isn't just a job. It carries immense cultural prestige. Being the designated health volunteer gives a woman authority, respect, and this unique social cachet within her community.
Oh, so it's a badge of honor.
Exactly, which is why families want to keep the role in-house.
Yeah.
But it creates a severe structural bottleneck for the government.
Right, because the report mentions this clash between these older volunteers and a new initiative. The government is rolling out a community health nursing pilot program.
Right, the CHN program.
Yeah. They're deploying trained community health nurses into municipalities to build digital health profiles for every single resident. In just 4 municipalities, they've already mapped out over 66,000 households.
That's a huge data set.
It is. But the older volunteers, many of whom are illiterate, are really struggling to participate in this new digital data collection.
And there you have a major friction point. You have traditional, respected community elders on one hand, and the modern demand for digital, data-driven health tracking on the other.
Because the system desperately needs that granular data, right?
Absolutely. They need those digital profiles to predict outbreaks and allocate resources effectively, but they cannot afford to alienate the 50,000 volunteers who actually hold the trust of the community.
Yeah, that is a tough balancing act. So once you move past the household level, the system needs another hub to catch people. And the most logical gathering place for a community is, well, the school. The report outlines this massive school health and nursing service program. It started a few years ago and is now operating in almost 1,400 schools, 1,387 to be exact.
And it's not what you'd typically expect.
No. My initial thought was the classic school nurse, someone handing out ice packs and taking temperatures. But these nurses are running like miniature public health headquarters.
They really are. They are intercepting issues before they become chronic. They calculate BMI to catch early signs of obesity or malnutrition. They distribute iron tablets because, anemia is a massive barrier to a child's ability to focus and learn.
Right.
And they are even trained in social-emotional learning to address mental health and suicide prevention, recognizing that trauma often manifests first in the classroom.
Yeah, the detail that really stuck with me was a specific success called out in the SWOT analysis. This program has actively reduced absenteeism among adolescent girls.
Which is huge.
It's massive.
Yeah.
And the mechanism for that is incredibly straightforward. The nurses provide menstrual health support and distribute sanitary pads.
Simple but effective?
Exactly. They are removing a biological reality that was being treated as a barrier to education. If a girl doesn't have access to pads, she stays home. She falls behind the boys every single month, which eventually leads to her dropping out.
And that simple intervention echoes throughout the entire national economy.
Really?
Oh, yeah. Keeping a girl in school delays early marriage, it reduces maternal mortality rates, and it significantly increases her lifetime earning potential.
Wow.
It is arguably one of the highest returns on investment in all of public health.
That's incredible. But I did notice a bureaucratic nightmare buried in the threats section for this program.
Oh, the ministry overlap.
Yes. It states that the school nurses literally don't know if they work for the Ministry of Education or the Ministry of Health and Population.
Yeah, that's a classic issue.
I mean, the health ministry pays them, but the education ministry controls the building and the students. Having two bosses who operate in different silos seems like a recipe for the entire program to just freeze up.
Well, it looks like dysfunction on paper, certainly. It is a very common symptom of interdepartmental friction when a successful program scales too fast.
Right.
But on the ground, the nurse likely doesn't care whose logo is on her paycheck. She cares that she has a physical room in the school to do her job.
That's fair.
The friction is just a necessary byproduct of putting medical professionals directly into an educational environment. By being there, they address adolescent sexual and reproductive health before those kids ever have to navigate the adult healthcare system on their own.
Okay, so preventative care in the homes and schools is phenomenal. But prevention only works when the environment is safe.
Right.
When a home is actually the source of trauma, or when a disaster strikes, all those preventative measures just fall apart. And this is where the system has to shift from prevention to crisis management.
Yes, the safety nets.
It's exactly. The report outlines social service units operating in 88 hospital sites. These are designed specifically to catch marginalized groups who usually fall through the cracks endangered tribes like the Rauti and Musahar, disaster victims, and even survivors of acid attacks.
And that's so important because those endangered tribes often have a historical distrust of state institutions.
Sure, understandably.
So the social service units are designed to bridge that gap. They provide a dedicated entry point so marginalized people aren't turned away or intimidated by a massive hospital bureaucracy.
And for the acid attack victims, they receive free, life-saving treatment at 4 dedicated hospitals in Kathmandu.
Right.
Though the report did note the heartbreaking reality that while the critical care is covered, the subsequent cosmetic reconstructions are not.
Yeah, which is devastating.
But here's where it gets really interesting. The safety net that truly forced me to pause was the One-Stop Crisis Management Centers, or OCMCs. There are 94 of these centers specifically designed for gender-based violence survivors.
And the statistics surrounding these centers, they really highlight the sheer scale of the invisible trauma in the country.
Yeah, it's heavy.
A staggering 58% of gender-based violence survivors never seek help or tell anyone. They just endure it in silence.
Over half.
Yeah. And when survivors do finally reach an OCMC, the data shows that psychosocial counseling is the highest utilized service, accounting for over 29% of all services rendered.
The regional breakdowns really paint a picture of how localized this trauma can be, too. Nationally, physical violence is the most reported reason for visiting a center, at about 26%.
Right.
But if you look at the Bagmati province, sexual assault spikes dramatically to 29% of cases. And in the Karnali province, rape constitutes an unbelievable 26.44% of all new cases at these centers.
God.
I mean, the emotional toll on the staff operating these 94 locations must be immense. They aren't just stitching up physical wounds. They are fighting deeply ingrained societal violence.
And the SWOT analysis outlines why this work is so difficult. The perpetrators of this violence are overwhelmingly family members or intimate partners.
Right, it's the people closest to them.
Exactly. So when a survivor makes the incredibly brave choice to seek help, they're often entirely cut off from their family, their home, and their financial support. They face a severe lack of resources when trying to reintegrate into society.
Which totally explains why the physical design of the one-stop model is literally a matter of life and death. If a survivor has to travel to multiple locations, they're going to fall through the cracks.
Think about the historical alternative, right?
Right.
A survivor would have to go to a hospital to have physical injuries treated and documented. Then they'd have to travel to a police station where they might face dismissive or hostile officers just to file a report.
Right.
Then they'd need to find a lawyer to understand their rights. And finally, seek out a separate counselor for mental health support.
That is exhausting just to hear.
Exactly. Every physical transition from one building to the next is a wall. It is an opportunity for the survivor to be intimidated, stigmatized, or simply give up out of sheer exhaustion.
Yeah.
The OCMC removes those walls. It puts medical care, psychosocial counseling, medical legal support, and police coordination in a single, secure location.
Wow.
It is a structural solution designed to protect the survivor from the very system that usually fails them.
That is incredible. So we've covered social trauma, but the report also details another form of devastation that can rip a family apart.
The financial side.
Yeah, the absolute financial ruin of a chronic illness.
Right.
The government has a program called the Bipana Nagarik Arshadi Upachar program. Basically, it translates to the Impoverished Citizens Treatment Program.
Right.
It essentially acts as the financial insurer of last resort for the poorest citizens facing catastrophic diagnoses.
And it covers 8 critical diseases: kidney disease, heart disease, cancer, head and spinal injuries, Parkinson's, Alzheimer's, and sickle cell anemia.
Heavy hitters.
Yeah, these are conditions that would otherwise force a family to sell their land, pull their children out of school, and just plunge into generational debt just to afford the medical bills.
And the scale is huge. In the 2080/81 fiscal year, they served nearly 42,000 patients across 135 enlisted hospitals.
But the breakdown of those funds is really telling.
Yeah, I looked at the financial breakdown, and the disparity is alarming. Cancer has the highest patient count, with over 22,000 people receiving treatment. But kidney disease, which had fewer patients, about 19,000, consumes nearly 50% of the entire 4 billion rupee budget.
Which is a massive portion.
Right. I mean, from a sustainability standpoint, having a single condition eat half of your national emergency fund, isn't this system a ticking time bomb?
It's a very valid pushback. It is a massive financial strain, but the driver behind that disparity is the actual mechanism of the treatment itself.
What do you mean?
Well, the vast majority of the funds allocated for kidney disease are paying for hemodialysis. When a patient's kidneys fail, they have to be hooked up to a machine that physically cleans their blood.
Right, dialysis.
Yeah, and this isn't a one-time surgery or like a finite course of chemotherapy. It requires the patient to sit on that machine for hours.
Oh, wow.
Yeah, several times a week for the rest of their life. It is an endless siphon of medical resources.
And it really highlights the epidemiological shift happening in Nepal. The
Right.
report emphasizes this rising tide of non-communicable diseases, or NCDs.
Right, because the country is rapidly urbanizing.
Exactly.
Yeah.
Urbanization, diets are shifting toward processed foods, and life expectancy is rising overall.
It's what happens when a developing nation spends decades successfully fighting infectious diseases. Cholera, malaria,
Right, you
tuberculosis.
survive those.
And when you succeed and people live longer, the population runs headfirst into chronic conditions like hypertension and diabetes.
Which lead to kidney failure.
Exactly. If those conditions aren't managed early, they destroy the kidneys. The Impoverished Citizens Program is catching people at the absolute end of the disease progression when it is the most expensive to treat.
Oh, so that's why the preventative stuff is so important.
Exactly. This is why those FCHVs with their malnutrition tapes and the school nurses taking blood pressure are so vital. If they catch the underlying issues early, they prevent the kidney failure entirely.
That makes total sense. And surviving those infectious diseases naturally leads to the final puzzle piece of this report. Nepal is undergoing a massive demographic shift.
Yeah, the aging population.
Right.
Hmm.
I mean, in the West, we often hold on to this outdated mental model of developing nations having a strictly youth-heavy population pyramid. Lots of young people, very few elderly.
Right, the classic pyramid shape.
But this report completely shatters that. Nepal now has 2.97 million elderly citizens, making up over 10% of their total population.
Which is the ultimate paradox of a successful public health system, isn't it? Well, you want people to live longer, obviously, but when they do, it creates an entirely new set of demands that the system just wasn't built for.
Right.
The report outlines a geriatric services program, noting that 61 hospitals now provide specific geriatric services.
Uh-huh.
The Koshi province currently has the highest coverage. And the top morbidities they are treating aren't acute infections, they are complex cardiovascular and respiratory conditions.
But the bottleneck they detail here is terrifying. For a population of nearly 3 million elderly citizens, the report states there are only slightly more than 200 trained human resources doctors and nurses who specialize in geriatric care in the entire country.
200 for 3 million people.
It's unbelievable.
The infrastructure is desperately racing to catch up with the demographics. Because you cannot treat an 85-year-old patient who has overlapping heart disease, early-stage Alzheimer's, and respiratory issues the same way you treat a 30-year-old.
Right, it's a completely different ballgame.
Exactly. It requires specialized knowledge of how different medications interact in aging bodies. The public health strategy has to evolve from simply saving lives to maintaining the quality and dignity of those extended years.
So what does this all mean? When you step back and look at the entirety of this report, it really redefines what a resilient health system actually looks like.
It really does.
It isn't just a collection of glass-walled hospitals and expensive MRI machines. It is a deeply layered defense.
Yeah.
It's an army of women walking mountain paths with colored tape to measure toddlers. It's school nurses handing out sanitary pads so girls can stay in math class and literally change their economic future. It's a secure one-stop room where a survivor of horrific violence can finally speak to the police, a doctor, and a counselor without being forced back out into the streets. And it's a dedicated fund ensuring a farmer doesn't have to sell his land just to afford dialysis. I highly encourage you listening to this right now to look at the health infrastructure of your own country. Where are your safety nets actually deployed? And more importantly, where are the gaps letting people fall through?
And, I want to leave you with one final thought to mull over.
Okay.
We talked about those community health nurses in Nepal,
Yeah.
the ones actively generating digital household-level health profiles for tens of thousands of rural citizens.
Right, mapping it house by house.
Exactly. They are mapping public health data in a developing nation.
Mm.
Meanwhile, in many ultra-wealthy nations, if you visit a new specialist across town, they often cannot access your basic medical history
Oh, so true.
because the private data systems are fragmented, they're proprietary, and they refuse to communicate with one another.
Yeah, it's a mess.
So, If a nation navigating the logistical hurdles of the Himalayas can successfully innovate localized digital health tracking at the grassroots level, it is entirely possible that the global south could eventually leapfrog the highly inefficient, disjointed medical data systems that currently plague the wealthiest nations on Earth.